University Hospital is probably the most respected healthcare facility in the city of Augusta.
That's where the surgery happens in the city. You know, if people need heart surgery, they go to university. Colorectal surgery, intestinal surgery, they're coming to university.
We are constantly talking about quality at our institution, at our board meetings, at our medical staff meetings, that we constantly want to upgrade and make sure that our patients are getting the top care that they deserve. Presently, we are able to upfit our hospital to the tune of about $20 to $25 million a year in new equipment. And there are not many institutions in the whole United States that have been able to do that.
Very surprised at how easy it was to come in, set up a practice, and benefit from fantastic referral patterns and a great center to do surgery.
I like the small town atmosphere, but at the same time, there's a large enough patient population with the diversity of patients to truly practice internal medicine. So I'm challenged every day on the job.
For me, it's a hospital that I can, do a wide range of procedures, and I'm not limited in my scope of practice because I have specialists who can help me with complex patients. And, there's a good volume of referrals in the area, and I think a really knowledgeable and personable staff of physicians who can help me, with all the different things that go into putting together a surgical practice.
You know when you get here that you're working with people who have been well trained, who are up to date, and that's very important too. At the same token, if you're a subspecialist who's thinking of coming, you want to, have patients who are being referred to you, I'd like to think that as an internal medicine physician that I'm taking care of the internal medicine aspect of their care, so that when I refer patients to the various subspecialists, that they'll be patients who have been thoroughly worked up and appropriately managed, and I think that's something that's important for physicians who are wanting to come, to make sure that their colleagues are going to be well-trained physicians, and that's something that I have found here at university.
It's just the perfect mix of a mid-sized city, adequate referral patterns, lots of, it's a big catchment that we get, and patients coming from the whole region, but without a lot of the big city hassles.
When we compared the cost of living in Atlanta or other bigger cities, we just couldn't stomach paying so much more for so much less, and so for us it was just not really something that we had to think too much about. It's a wonderful cost of living, so we have a very nice home for a very decent price, and we don't have to live extremely far away from work, and so that was a big draw for us to come to Augusta.
We are actually a community of 3 counties, Richmond being the largest, Columbia County, and Aiken County. We have a highway system that completely encircles the community, interstate system. We have the largest man-made lake east of the Mississippi, a 72,000-acre lake about 20 miles away. We have one of the largest forts in the military system, employs 19,000 people. And of course, we also have a large employer here in Aiken County, the Savannah River site, which employs about 10 to 12,000 people as well. So one of the interesting things about our economy in this area is the fact that there's so much There's so many employees employed by government, whether they be state or federal, that when there is a recession like we've had, it's not hit our community like it has in other parts.
We've been very fortunate in the city of Augusta that we still have a low unemployment rate. There's still plenty of jobs and new companies moving to this area, and lots of opportunities for jobs and growth. And I think that this area is only going to continue to grow. There's been a lot of money not only at the hospital but in the community itself to upgrade and make the downtown beautiful. And I think that's a real draw for this city, and I think that's only going to improve. Most of my time is spent with my children, and so there are wonderful parks scattered throughout the area that we spend a lot of time at. During the summer, the river is a beautiful area to visit and a good place to cool off, so we spend a lot of time there. When I get a free moment, I love to go watch the ballet, which is something I did growing up. And there's all sorts of wonderful restaurants that the food is just phenomenal, so there's always something to do on the weekend.
Seems like anything that we've wanted to do, we've been able to do pretty easily. We've gone to Hilton Head a few times, and so it's nice to have a beach within reach. And you know, anything that we recreationally, I mean, we live right by the Augusta Canal, so we go out there frequently and ride our bikes or jog, and we live right by several playgrounds, so everything that we like to do, we're able to do, and the weather usually is cooperative.
Augusta is very well situated in terms of, you know, in the summertime we made the drive down to Myrtle Beach, and the kids really like that. Of course, Atlanta is only an hour and a half away. So it's just lots of different things that are sort of right here at your fingertips. So I enjoy it very much.
Well, I love my job. This is what I've always wanted to do. I have a passion for it, but I also enjoy living in a small town and having that small town feel with wonderful, friendly people, and the river and the opera and the ballet, and then having the facilities that are so technologically advanced and available for my patients.
I remember my wife telling me, you know, probably about 2 to 3 months after I started, she was like, I can see it now. This is the man that I married, the man who enjoyed medicine and came home and talked about the different patients and talked about, you know, the differential diagnosis of what was going on a particular patient. So I enjoy practicing medicine again, and that wasn't the case until I made the decision to move to University Hospital.
Even when, you know, you're working hard and times are busy, if you can go home to a place that you enjoy and a place that's easy to live, then that makes all the difference. Good days or bad days at work. So Augusta's a great medical community, and I don't think anybody would be disappointed.
You know, having the support of co-workers, having the support of the hospital, having the support of the community, all of that's very important in terms of satisfaction, and you know, I think I'll be here for the long haul.